Welcome to the Byja radio show. I'm your host, Dr. Byron Jasper, and we are recording live from J. Kinba Executive Suites in Baton Rouge, Louisiana, with special production by Becnel Media. And we are back for episode 22, which is good and a bad thing. I will say it is a huge blessing to make it to the end of season 2. 22 episodes, 11 in season 1, 11 in season 2, and we are closing out on a high note. And I say we, you should know by now that if we are talking about Byja Radio, it's me, Dr. Jasper, your host, kind of bringing us in, but I have to always kick it to my amazing co-host, the one, the only, the stupendous high of high, the one who works all the time. I sometimes call him the hardest working man in show business, Mr. George Becnel, a.k.a. Patient Zero. How are you doing, brother, sitting in the co-seat looking fly today?
Man, I appreciate that, good brother. I'm just trying to be like you when I grow up. You know, I'm doing well. I can't complain, man. We're recording another podcast, another opportunity for us to maybe give some information to some good people about some healthcare and fuss about cartoon theme songs, so... Well, it's a good time. It's gonna be a good time.
I don't think it was an argument, really, because clearly we all know who won. So,
man.
And the fact that you actually admit it, I appreciate it. So,
I went back, man, and I was just thinking about the Darkwing Duck.
Yeah.
Let's get dangerous. That's the cool. That's the
best part. That's the best part.
But it's the only part.
The only part, exactly. So no one else really and truthfully knows the theme song other than the person who maybe wrote it. Other than that. DuckTales is way better, and we settled that in an outside discussion. If you want to know where this conversation originated, check back. I think the last episode or episode before last, it might be episode 20 or episode 21. We had a very detailed discussion about which theme song was better. So check that episode out. But today we are going to close out season 2 with information about something that we have possibly touched on. But we're going to talk a little more in detail about it today. And it's more about the U.S. healthcare system and how it stacks up to other wealthy countries around the globe in terms of its overall healthcare system. And it's something that kind of came to my attention when I do my usual look across the healthcare landscape for things that we may talk about, things we may discuss. The story caught my eye about this report that came out at the end of 2024. That really pretty highlighted some things regarding the ranking of the United States overall and pretty much what we could do to do better. So I don't know if anybody listening is familiar with the report, but we'll talk a little bit about it. And I'll start by asking George the first question out of the gate. The name of the report is the Mirror 2024 report put on by the Commonwealth Health Fund. So George, any idea anything about this report? Ever heard of it before? Anything familiar with it? Or is this something completely new to you?
Yeah, this is something completely new to me. I've never heard of the Commonwealth Fund report. I never heard of the Mirror series. So I have no clue what this is.
Yeah. So it's not something we put into the notes, but it's something that we want to give a little bit of background on. So the Commonwealth Fund is a private independent foundation, and it was established in 1918. It's a mission. The mission of the Commonwealth Fund is to promote high-performing healthcare systems in the United States, which hopefully will achieve better access, improved quality, and greater efficiency, particularly for vulnerable populations, such as those that are low income, people of color, and the uninsured. So basically, the purpose of this organization is to really and truthfully find ways to promote better healthcare across the United States for these vulnerable populations, and they've been doing these types of things for a long time. Then they went on ahead and started working on the report called the Mirror Report. The series of reports started in 2004. So you can see this report has been around for almost 20 years. And with this report being around for 20 years, they do this deep dive pretty much when the report comes out and say, well, how does the United States stack up against other wealthy countries? So when they looked at other wealthy countries around the globe, they basically ranked them from 1 to 10 in a bunch of categories, 1 to 10 in a bunch of categories. But the foundation is not where they're really and truthfully trying to, in essence, downplay stuff. I think what they're trying to do is say, look, we want to just give you an idea how we stack up against other countries.
Right.
Just because a lot of people think, well, you're in the United States, you must have the best of the best. You must be at the top of the list. So keep doing what you're doing. Well, this report hopefully will open eyes into where we rank in a lot of categories. So based off of that, George, I'm going to start again with questions for you because I already know you have some idea what we're going to go into with this. But I want to know just from your gut reaction, if I'm talking about a organization that's working on improving healthcare for vulnerable populations in the United States, and we have a report called Mirror Mirror 2024. What does your gut tell you that the United States will be in terms of rankings in this report? Do you think they're going to rank high, middle of the road, low, bottom third, top third? What would you say? Just your gut reaction.
My gut would tell me that the United States would be middle of the pack. And you know, things like healthcare and education, I would assume that we're middle of the pack. Now, you know, you start talking about GDP and things like that, I'd assume we'd be near the top.
Okay.
But healthcare, absolutely middle of the road, in my opinion.
Okay. Now, that's your gut reaction. Now, is that across the board or across the 10 wealthy nations we're comparing to?
Oh, we're probably last against the 10 wealthiest nations. I was just thinking, you know, middle third because, you know, you got the other superpowers, right?
Yeah.
That are probably doing things more efficiently than us. And then we got to be ahead of like some of these third world countries that don't have anything. Right. So that was my gut. But if it's just against the top 10 wealthiest, we probably last, bro.
I got you. So that gut reaction changed real quick.
Yeah.
Like,
we probably last.
Like spoiled milk on the stomach, right?
Oh man, like raw sushi from Tsunami.
Gas station sushi. I got you. So overall, George is hitting the nail on the head, as you already know. If you're talking about healthcare and you're comparing it to other places, obviously it's relative. If you're comparing it to places that don't have a lot of systems in place, a lot of economic success, you're going to probably say, look, we're doing a lot better than them. But if you're comparing it to other people who are around the same playing field, we tend to pretty much fall to the back of the pack. So in this report, which is a pretty significant report, the idea of the report, they kind of broke it down in a couple of categories, and I believe it was 5 categories overall. Access to care, care process, administrative efficiency, equity, and health outcomes. So again, access to care, care process, administrative efficiency, equity, and outcomes. Okay, so we're going to go one by one for 5 domains. So again, of course, you know we got to ask patient 0 his feeling, and then we're going to basically pull out the actual results. So George, we're going to start with the first category. So first category on the list, access to care. Before you have to even remotely look at the report, where would you rank the United States? As a matter of fact, let's go back. Before I do that, let's talk what other 10 countries are often being compared, because that may actually help inform what your numbers are going to be. Okay, so just so people are aware, we ranked the top 10 wealthy nations in this report, and of the top 10, in no particular order, we're going to go over what 10 nations we're comparing to. Okay, so number 1, United Kingdom, UK. Number 2, New Zealand. Number 3, Canada. Number 4, Switzerland. Number 5, Australia. Number 6, the Netherlands. Number 7, France. Sweden is 8. United States is 9. And I believe, did I say Germany?
No, I don't think I heard
Germany is 10. Okay, so
I didn't know New Zealand had their money like that, man.
Well, New Zealand apparently is balling, right? So we need to take a trip, sounds like it. So,
yeah.
All right, so we got 10 nations, and hopefully I didn't leave anybody out. I'm trying to read them in a way where we don't give anything away. So I read them out of order, but overall we got 10 nations, okay? With the 10 nations, we're going to start with the very, very first category. And the very first category, George, as I already mentioned to you, access to care.
Last. We're last. Next category.
I didn't even get the question out, man. I was going to say, do you feel like there is anybody less than us? But I feel like automatically you ought to.
No way. Because there's people there's people who don't have high income at all that can't even afford to go to the doctor.
Yep.
Because if you don't have a job with any type of group insurance, healthcare is not even feasible. Yep. So we're last.
Last, 100%. Final answer.
Not a doubt. And this is without me looking at the notes.
This is also you not phoning a friend.
I don't need to phone a friend. I don't need to take away two options. We're last.
50-50.
We're last.
It's one of those things that if you all could see his face, the amount of disgust in his face means if he was wrong, he would probably argue against that actual response.
Yeah, I wouldn't believe it.
The report is flawed.
I wouldn't believe it.
It's automatically
because I'm pretty sure people over there in New Zealand like taking care of their people.
Yeah, absolutely. Especially a lot of the countries that you already know probably have a universal healthcare system, so it makes everything accessible, right?
Yeah.
So it's one thing to say, look, we don't have universal, but as you just said, is there any access for certain people who fall in certain incomes, certain demographics, certain areas of the country? And you flat out hit the nail on the head. So the United States, in this report, comparing to the other 10 wealthy nations we listed, the United States ranks dead last.
Terrible.
In access to care. Number 10, United States. Number 9, Australia. Number 8, Switzerland. Number 7, Canada. 6 was France. 5, New Zealand. 4, Sweden. 3, Germany. 2, the United Kingdom. And 1, the Netherlands. So we rank dead last in access to care. And we're going to take a brief pivot to that. And George kind of, I think, what's the word I want to look for? Emphasized, we're going to use positive words today. George emphasized his feeling on why. And he gave you some background as to why. But my thought overall, which I'm going to still ask him because I already know kind of where he is, but I'm going to ask him anyway. Do you think that's a surprise to some people listening? And I'm not talking about you, but listening. Do you think some people would say, yeah, I would have thought we were number 5? Do you think that?
I think some people would be surprised because we are trained to think that the United States is the biggest and best in everything, right? And look, America is a great country. I'm not going to sit up here and try to bash America because America is still an amazing place to be. Mm-hmm. I'm just saying that we don't have it right all the time in everything. And I think that's the almost illusion of America, right? Because sometimes we're led to believe that we just top tier in everything across the board. And when you start reading about healthcare, education, and other things, that's just simply not the case.
Yeah.
So I would think that some people would be surprised at this and some people aren't. But there's could be a lot of people that's like, wow, really? We're last?
Yeah. Especially when you're talking about some of the people we're comparing to, like the fact that we are literally bordering Canada, but we're so far behind them in healthcare related things. People are pleasantly or shockingly surprised, right? Some people are like, oh, well, I could see it. But some people are like, nah, I would have never guessed that. And you would think that we are just on this other side of the globe, right? A lot of these nations are on the other side of the globe. So that may be why, because stuff is different on this side, in the Western hemisphere compared to the Eastern. But a lot of it just has to do with basically policy and politics and things of that nature that don't necessarily have a true place in healthcare, or shouldn't, I should say, but yet they do. And I would say it's not surprising to a lot of people who work in the healthcare system that we rank as low as we do in a lot of areas, because we see it every day and we deal with it every day when we're dealing with the headaches of access, where we are trying to get people into certain specialties or certain clinics or to certain ancillary services, and they just don't exist anymore. Or if they don't exist, the wait is so long that by the time the person gets in, it's pretty to the point like they could have done 14 other things. They forgot about the appointment. They're not even worried about it anymore. It's gotten so bad that it's so far gone from the referral that we put in. It's so many things that can happen between when we put in the actual place of, hey, you need to go see so-and-so, to when they get in. It's no surprise to us, right, in that healthcare field, that we have such bad access. So I'm not surprised by it at all. And I think overall where we rank in that category shouldn't surprise many people, but wouldn't be surprised that it does. So we're going to move on to the next category. Next category, George, it's called care process. So from a care process, this one was a little bit surprising to me. And I think for the care process, a lot of people would say, well, what is a care process? And I think overall what they're saying in the care process is, how do you basically deliver care in a sense of, are you giving more follow-up care, acute care, preventative care? Are you really working to give people care in a way that allows them to have healthier outcomes and things of that nature? Now, this one was a little surprising to me because it wasn't the most clear on what the criteria was, but it did give me some sense of where they're kind of putting things on this scale. So, George, where do you think the United States ranked in this category of care process?
So I would assume that we're somewhere toward the bottom again.
Okay.
Because I feel like, in my opinion, the process is a little flawed. But it depends on what you consider the care process, because that definition was a little broad.
Yeah.
So I don't know. Yeah. I would think we're toward the bottom again.
Yeah. So to clarify, the 2 to 3 things that stood out when I read the report, the care process was preventative care, safe care, and then in a way coordination of care. So for those kind of topics, where would we rank? To me, I said, look, we're probably going to be a little bit better, because coordination of care and safe care, you have a lot of things that have to be in place before you can, in essence, get stuff approved and get stuff done, right? You don't just go straight into having an operation. A lot of times you got to have a lot more things checked before those things are done. So with that, I know there's more focus than what people probably would perceive, depending on where you sit in the healthcare industry. And what I mean by that is, if you have more resources, you're going to probably see a lot more benefit here. You're going to see more benefit of preventative care when you have healthy food choices in your neighborhood and you have a playground and a walking track in your neighborhood. You can look at prevention a lot differently from a healthcare standpoint than if you live in a food desert, or you live in a place where there's not a lot of safety, so you can't go outside and work out because, of course, there's going to be violence happening. So I think the care process was a misnomer, but I do think what they're trying to say is, compared to other countries, do we have a lot of the processes in place that will allow us to deliver care in a certain way? So overall, George, tell me one more time, where do you think we rank?
I would have said 7th or 8th, but apparently that's not true. So
yeah. So where? Why don't you tell the people where the United States ranked according to this report?
So we're second behind Ballin, New Zealand. Maybe it's because of the advances in telehealth, because everybody has a smartphone in their hand, and it's just easy to deliver care, I guess, in terms of, urgent care via telehealth. You can go to therapy, telehealth, so I think maybe that helps.
Yeah, and I think that's a part of it. I think the other part may be, like you said, besides the technological advances, it may be that they're wanting patients to be more centered in the actual care, compared to everything's covered. This is the way we do it because everything's covered. So you don't really have a choice. You only get one set of meds because these are the meds that are covered, rather than you get to pick based on your preference, right? You have 5 drug options for your potential high blood pressure, compared to you only get one because that's the only one covered on this universal healthcare plan. So that may be more of what they're talking about. Like, you have a lot more choice in the process and you're a lot more involved, rather than you kind of get what you get. So that may be it, but we're ranked number 2 there. So got some upside. We got a 10th ranking and a 2nd ranking. So, we're kind of doing well there. So we're going to move on to the next category. So based off of the next category, we went from access to care, care process, administrative efficiency was the number 3 category. So George, in your spirit, what do you think can we rank in administrative efficiency in the United States compared to the other 10 wealthy countries on this list?
Yeah, we probably last again.
Okay. Why do you think that? Give me your insight into what may make you think, hey, we're last.
Well, it's because, typically on average, anytime you feel you need care, it's just so many people you have to talk to. Like, it's so many people. Like if you think about it, okay, I call and make an appointment. That's one person. I'm gonna have to talk to the nurse. That's another person. Then I'm gonna talk to the doctor. It's another person. Then I potentially may have to talk to my insurance company. That's another person. Then I potentially have to go Then I need to go talk to the pharmacist. That's another person. Then I'm probably going to have to go for a follow-up. Or, God forbid, I need to go to a specialist. Then I'm going to have to repeat the whole thing again and talk to another receptionist, a scheduler, another receptionist, another nurse, another doctor, and another pharmacist, and on and on and on. So it just seems very inefficient, in my opinion.
Yeah.
So other countries, Ball in New Zealand, the UK, and all them, they gotta have it together more than us in terms of administrative efficiency.
Yeah, and I think you touched on a lot of things. It's a lot of people in a very, very long equation of getting a patient from A to the finish line. And if you're getting from A to that finish line and you have 14 people you have to go through, things just slow down because you have to have so many touch points of phone calls, faxes, prescriptions, referrals, orders, and the names go on and on and on.
It takes forever because, like, think about this, right? So let's say, I don't know, something happens to where I fall down and I break my leg, right? I might go to the emergency room. Well, that's a bad example. Let's say I'm just feeling bad, right? I go to the urgent care. They determine is something wrong, right? So I go to urgent care. They determine there's something wrong. Then I have to. They might give me something to help me feel a little better, but I'm still not fixed or cured, right? So then I need to go see my PCP, my primary care physician, right? After that, my primary care physician decides or determines that now I need to go see a specialist. Now I go see a specialist. All of a sudden, I'm feeling terrible, and it's going on like, I don't know, 3-4 weeks, and I still am looking for answers.
Yeah,
that's not an efficient system.
Yeah.
It's just not.
Yeah. And that is potentially fast in your example, because for you to be able to get all that done in 3 or 4 weeks in a system that we know very well, that's actually considered fast.
And that's terrible.
And that's terrible compared to somebody who can possibly do this in 24 hours, maybe 72 hours, depending on how fast or how severe or how problematic their issue is.
And think about it, man. Like, think about that from a personal experience. So, like, most jobs, you'd be lucky to get 3 weeks of vacation.
Yeah.
So now I'm feeling terrible for about 3-4 weeks at minimum. What do? You continue to go to work, or you call in. Hopefully you got some sick time. Like, God, and that's for like me. I'm considered a white collar employee. God forbid I'm a blue collar employee to where I'm out here having to do physical labor.
Yeah.
Being sick like that, then you can't work. So then what do?
Yeah.
You know what I mean? Like, that's not efficient, and that can wipe out somebody's life, somebody's livelihood.
Yeah.
It could wipe out all their vacation time. It could have a negative effect a lot of different ways.
Yeah. And so I think you are spot on. We were surprisingly not dead last in administrative efficiency, according to the report. Out of the top 10 nations from the list that we were provided, the United States actually ranked number 9 out of 10 for administrative efficiency. Apparently, Switzerland was number 10. We were 9. Then Germany, Sweden, Netherlands, Canada, France, New Zealand, Australia, and the United Kingdom. So based off of that, we were 9th out of 10. And with that 9 out of 10, you would basically say, well, what is the reason behind it? Well, most of us know it. If you're listening to us and you've been listening to us, it is basically a lot of complex paperwork, extra phone calls, a lot of administrative paper pushers and middlemen and things of that nature, pharmacy benefit managers that just slow down a lot of things for no real reason other than that's just the way someone thinks it should be. And it doesn't improve healthcare outcomes. It doesn't get people back to work, as George just mentioned, faster. It just happens. And we often in America just know that that's what it's going to be. We rarely expect that healthcare stuff is going to happen quickly, and we just get used to it, and we just basically settle for it. And this report kind of hammered that home, and I think it was spot on when they said they were 9 out of the top 10 wealthy nations. So we'll move on. We got 2 more categories, and the 2 categories that we're going to talk about, I think pretty much people know where we're going with this one. So in terms of equity, health equity across the top 10 wealthy nations. Yeah. George, what are your thoughts? Because I see you smiling, and I think you already have a sense of where we're going with this.
Yeah, man. You know, so I don't like where this is going because I feel like I'm going to come off as being like super negative. Mm-hmm. But if I'm just being real, in America, for some of the reasons that we talked about earlier, talked about not having access to group benefits, some people not having access to insurance at all, insurance being very expensive if you're not part of a group plan through your employer or your spouse's employer. Equity, we got to be dead last. Like, we have to be dead last. Like, there's probably countries that's not in this top 10 that we're behind, if I'm just being honest. Mm-hmm. So we're last.
Yeah.
100%.
Yeah.
I don't even need to look.
Yeah. So we were 9 out of 9 because one of the 10 countries didn't have data on equity, apparently.
What was the countries?
So that was, I think it was Sweden. They said Sweden didn't have the data overall ranking equity in some weird roundabout way. And because of that, they ended up going with the top 9 countries. And of the top 9, we were 9 of 9. And that is not surprising, as George mentioned, as a lot of people know. And it's not something that we are happy about, but we are honest about it, that Black and brown people in the United States often have the worst healthcare outcomes. We really work on combating that here at Byja Clinic and Byja Charitable Alliance. But one of the things that we really tried to do is say, instead of just saying, well, there are healthcare disparities and we're working on it, how about we just fix it? So by us working on it and saying we're working on it, we're going to continue to work on it and work on it and work on it. It's never going to get better. But at this point, the report kind of just says, yeah, that's true. It's just bad, and we know it's bad, and we rank 9 out of 9, and it's not getting any better, and it's just something that everybody kind of just accepts. So we're trying to work on that, but we're really seeing that this report is highlighting something that a lot of us already know. If it's something that bad and it's not getting better, why not do something different? But the report kind of just says, look, we have inefficiencies in this area, health equity being one of them, and we know that it's a problem, and we're just going to keep on, hopefully working on it is the best way I can say. And it's not because the report is trying to, in essence, paint this picture of negativity. It's saying that this is something we notice is a problem as far as 2024, and it's not necessarily where there's a true end in sight. So based off of that, we have one more category that we're looking at. And George, I think this is the category you would say you kind of have a gut feeling on as well. So the last category of the 5 categories in the report was outcomes, health outcomes. So again, we went over 4 of the categories, and just to recap, so in terms of the first category, access to care, the United States was 10 out of 10. In the care process category, they were 2 out of 10. In the administrative efficiency category, they were 9 out of 10. In the equity category, they were 9 out of 9 because one of the countries didn't have data. And the last category is health outcomes. So, George, with health outcomes as the final category on this Mirror Mirror report from the Commonwealth Fund for 2024, where would you say the United States ranks of the 10 countries listed?
So, if you're last in health equity, right? You're up there in the care process, right? But you're last in access to care.
And second to
last in administrative efficiency. You're probably going to be last.
Okay.
And if you think about it, it makes sense because the example I just gave you, right? Let's take it back to, I went to urgent care and then I had to follow with my PCP, and it's something is just terribly wrong. I think a lot of people who are in a financially strapped situation, which in this economy is probably like a big percentage of people, right?
Right.
Before you find the answer or before you find, whatever's wrong, think about it. It takes so many trips to the doctor, right? So I'm going to give you an example. Mm-hmm. I have a gluten intolerance, and you know this as my doctor, right? I found out over a decade ago I had a gluten intolerance. So I was going to my PCP at the time with stomach aches. He didn't know. I got referred to a gastro doctor, which helped. But man, like there was no gluten intolerance test back then, and I was really struggling. I felt terrible. I was sleeping 14 hours a night, had eczema, had bad headaches, felt awful,
miserable. Yep.
And I had to go to work in the meantime. But I had an endoscope, I had a colonoscopy, I had all these tests, and this was over a process of 6 months. So imagine somebody who didn't have group health insurance, right, like I had at the time. Number one, you run out of money. Number two, you run out of time. And number three, after a while, just being aggravated with the whole process, I think people learn to accept being unhealthy as a new normal,
right?
Because of the system. So it makes complete sense that we would be last in health outcomes, because if you just learn to manage feeling bad and having to go to work anyway, it's not a good health outcome. It's just not.
Yeah.
So we got to be last.
Yeah. And I think you are, again, spot on. If you're ranking in the bottom of 3 out of the 4 categories we listed, and if not dead last, you're at the near bottom, then you're probably going to be spot on about being last in health outcomes. And you are 100% accurate. So out of the 10 countries in this actual last category of health outcomes, we ranked a total of 10th, right?
Yep.
So health outcomes was number 10. So for this category, to be specific, we were number 10 at the United States. Germany was 9. The United Kingdom was 8. Netherlands was 7. Sweden was 6. France was 5. Canada was 4. New Zealand was 3. Switzerland was 2. Australia was 1. So basically, we had a poor ranking in health outcomes, last. We had a poor ranking in health equity, last. We had a poor ranking in administrative efficiency, second to last. And a poor ranking in access to care, last. And this is in comparison to the top 9 other countries. We're number 10 in that category. So overall, in terms of rankings, it gave an overall ranking after you did all 5 of those categories, okay? So overall, George, I gave you this in your notes. If you don't mind looking at that and reading out the top 10 countries in this report overall. And you can go in any order you want. You can go from 1 to 10 or 10 to 1. So what were the overall rankings of the top 10 wealthy countries featured in this report?
So number 1, the highest ranked country would be Australia.
Yes.
Number 2 would be the Netherlands. Number 3 would be the UK. Number 4 would be Ballin, New Zealand. Number 5 is France. 6 is Sweden. 7 is our neighbors to the north, Canada. 8 is Switzerland. 9 is Germany. So I guess Benz and BMW is not doing too great these days. And 10 would be the United States of America.
Yes. So overall rankings, number 10. And again, that should really and truthfully, hopefully, in my book, wake people up to say, what are we doing? You are really happy if you're obviously in good health, because it's not a problem that you're worried about. But when your health goes into a negative space, you can't sit there and tell me you're confident that everything is going to work out to your benefit because of the efficiency, because of the equity, because of the access, or because of the, for lack of a better term, outcomes in our healthcare industry. Yet we're just happy with it being the way it is and don't want to really work on changing it or doing anything different.
So I hate to cut you off, but I'd be curious to know the economics behind our healthcare system and which of these top 10 healthcare systems is generating the most money.
Yeah.
I bet you we'd be number 1.
Well, I would say definitely spending the most. I don't know about generating, because obviously that's a term, but I'm glad you asked. So good segue. So I, of course, looked at the healthcare spending, because one of the things that we noted in some of the documentation from the report is that they talked about spending of the United States. So the United States spends nearly twice as much as the other countries on this list per capita in healthcare dollars. Twice as much as all the countries. So I say, well, let me see if I can figure out how much they're spending in comparison to the other countries. Okay. So who was number one in the overall ranking? It's easy to remember.
Spending?
No, just overall rankings that you just read. Who was number one? Australia was number one. Okay. So Australia in the per capita spending overall is number 7. So per capita in 2024, Australia spent $5,982 for healthcare spending per capita. The United States spent $12,914. So the number one country on that list spent around $6,000. We're spending $13,000. So that should tell you kind of what we're dealing with. And I'll go through the rest real quickly. So United States, $12,914. Switzerland, $8,833. Germany, 7,383. Sweden, 6,662. Netherlands, 6,531. Canada, 6,319. Australia, already said, 5,982. France, 5,880. The UK, 5,268. And as George likes to call them, Bola, New Zealand is at $5,187. So of the top 10 countries, we spend the most and have the worst outcomes.
Well, it's obvious. I mean, think about this. When you bought your car, who did you pay?
Usually it's the dealer, the person who's potentially selling the car.
Okay. So, you have a janitorial service come take care of the clinic. Who do you pay?
The janitorial service.
For the service.
Yeah.
You wearing glasses. Mm-hmm. Who did you pay?
Mm-hmm. Usually the person selling the glasses.
So it's obvious why we're spending the most money, because you pay more to the insurance company than you do to the actual doctor who's providing the service.
Correct.
And if you really think about it, so, I look at doctors and I look at, sometimes lawyers and people who rack up a bunch of student loans and spend years and years in school. You have to make those professions worth your while. So doctors and lawyers and everybody else need to get paid. Mm-hmm. So you can't be living near the poverty level, working as a doctor, because it's not an attractive field to go to.
Correct.
So doctors need to make money, but they're getting paid less than the insurance companies that's getting paid for the services.
Correct.
So it's not at all surprising to me that we're spending the most money in healthcare because of the way things go. It makes sense for you to pay your janitor service for the service they provide. And you only pay them. It makes sense that you might get a loan from the car from like a loan company.
Financing.
But the money goes to the dealership for the car that you bought.
Correct.
It's not a finance thing with the insurance. Like, they're getting paid more money than the doctor. So I don't see how we would spend less money the way things are.
And I think you are spot on with that, but I also will add one part of it. You hit the nail on the head with, we're spending a lot because we have a system that's set up to where you have a lot of other people in the equation. But I think the problem also is there is no transparency on how much anything costs in healthcare. At least with the car that you're buying, you have an idea of how much things cost. At least with the potential glasses you're buying, you have an idea how much they cost. And even with the janitorial services, you have an idea how much the cleaning supplies cost, right? In healthcare, it's probably the only industry, if not one of the few industries, where you have no idea how much anything costs unless you are in a very unique position. A, you're working at an insurance company. B, you used to work at an insurance company. Or C, you're in a direct primary care practice, because usually we will tell you how much things truthfully cost and make a decision on whether you want to pay that cost or do you want to pay the, for lack of a better term, insurance cost, which is let's use your insurance and hope it's covered. But even with the insurance cost, you still don't know how much it costs until months later. And then that cost is actually inflated because you'll get a bill or an EOB, an explanation of benefits. And you're going to look at it and think that the things that were done cost that much when it really doesn't, and it's a fraction. So it's a very bad system. And as you were saying, you have a very bad system that is perpetuated to continue in that way. And it's not a surprise that we're spending so much because we don't know how much anything costs. So to us, we think the x-ray is normally $500. Well, that's actually reasonable when it really is $50. And you're literally paying 100 times more than what it needs to be. And you're over here surprised that, well, why are we spending so much? Well, we really don't know how much anything costs.
So what else in the United States can you say is a different price because of the method of payment? You know, every now and again you might pull up to a gas station that might give you a cash discount versus a credit card. But even that is like 5-10 cents a gallon difference.
Nominal. Yeah.
You know, like imagine going to Dillard's and picking up a shirt that you see that's $75, and the cashier is like, "Oh yeah, that shirt's $75 for cash." However, if you put it on this credit card, now that same shirt $750.
Yeah.
You would look at her stupid.
Yeah. Yeah.
You know what I'm saying? Like it wouldn't make sense. You know what I mean? So it's like, what else in the world works like that?
Nothing, right? And it's a mystery that people who benefit from the mystery want you to continue to perpetuate that mystery. I had a call today, and with the call today, I had a person calling who literally was saying they were tired of the care they were receiving at another clinic, and at that point they were just looking for something different. We had a brief discussion on direct primary care and how we do things, and the first thing that they said after I explained the model was, yeah, that makes way more sense than what we do with everything else in healthcare. And it's the same answer every time. No one ever talks to us when we talk to them about direct primary care and say it doesn't make sense the way it pretty much works. It's more of they're not used to it, or the number is not something they can feel comfortable about. But no one really says, well, the insurance system is better. No one says that. I've yet to hear anybody say, I love the insurance system so much, it works so much better. Now, they may say, I have good insurance and I want to use it. They may say, my insurance covers more stuff and I want to use it. But no one says everything in that system is better. The outcomes are better. The efficiency is better. The access to care, no one says that. They just say they have insurance, it's in place, we want to use it, or I'm not used to paying for stuff out of pocket in this industry, so I want to keep doing what I'm doing. But most people can wrap their head around, I pay for something directly, I'm going to get a regular price, I'm going to be able to afford it, and then I'm going to be done. And that's it. I got the service, I got the medicine, I got the image, I'm done. It's not, I got it, I don't know how much it costs, I'm hoping that it's covered, I'm hoping I don't get a bill, and I'm hoping that everything is done. But if it's not, I'm going to be willing to do whatever they tell me to do. Like, no one says that out loud, but that's the game we're playing. And again, direct primary care remedies that. And if we can remedy that overall and get people to unplug from that matrix and literally step into the world of, let me figure out how healthcare works, how much it really costs, and if this is a better fit, people are usually happier and healthier. And even in this report, most people would read it and say, yeah, we kind of know it's bad. And then the next response is, but we're going to kind of stick with it because we don't know another way. Well, if you're listening to this episode and you've made it to the end of season 2, we're hoping you've heard us say enough over and over that there is a different way. There's a better way, and you can be a part of it. You just need to do something different, which is taking what we're saying and putting a plan in place and stepping into action, referring this episode to other people so they can realize that, yeah, you're spending a lot to get really bad outcomes, really poor care, and yet you're just going to stay in that situation.
Bro, just do the math. That's all I'm saying. Just do the math. I'm not telling anybody not to have health insurance. I have health insurance. I will not go without health insurance.
Right.
Especially something like a critical care insurance.
Yes.
Because if you get in an accident, something happens, you go to the hospital, that could ruin you financially.
Yeah.
So we're not saying don't have health insurance.
Yeah.
But what we are saying is, don't just sit there and take what people give you. Mm-hmm. Do your math and do what does what works for you. You know, like I have a job, I have group health insurance. I looked at all the options. Yes, there's a almost zero deductible health care plan mm-hmm. that I had that I had the option, right? That wasn't the best option for me. I chose a higher deductible plan because A, it was cheaper, and B, I pay a membership fee to the Byja Clinic, and I get better care there. So for me, the money balances out, and I have access to good care. You know what I mean? And then in case I need to go to a specialist, or God forbid, I need to go to the hospital, I'm still financially covered. Yeah, I'm good.
Yeah.
You know, so what we're telling you is don't just sit there and take it, because I promise you this, you go buy a car and somebody tells you that a price you don't like for the car, you can go to the next dealership and see if you can get a cheaper price for the next car. You know what I mean? Or like you go buy a shirt, you go look to see if you go to Dillard's and you don't like the price of the polo at Dillard's, you probably could go walk down there to Macy's first and see what's happening. Like, why? I'm just saying, do that with healthcare. That's all I'm saying.
Yeah, and if you can do that, I think you'll be pleasantly surprised at how much better it is over here, both from a patient standpoint, even a physician standpoint, and more importantly, from an overall spending standpoint, where you're saving money, you're having better outcomes, you're getting higher quality care, and everybody in the equation starts to win, as opposed to the only people winning in the other equation is the insurance company. So with that, we're going to slowly close out season 2. I think we're going to be on break for a little bit. We were on break probably for a week because we had snow in Louisiana. So if you're listening to this episode, whenever you hear it, yes, it did snow in Louisiana, so that threw us off.
Yeah.
But we're going to literally close out the season, get our ducks in a row, and then come back for season 3 and hopefully have some good content. And then we're going to work on bringing some guests out. So before we close out with the last few seconds of the episode, I'd just like to say shout outs to a lot of people who have literally supported us, listened, talked to us about episodes, given us feedback, given us positive reviews and ratings. So I'm just going to start throwing some names out. I'm sure George got some names that he want to shout out. So I'm no particular order. So I'm going to say shout out to Brother Antonio. He definitely is a listener.
Yep.
Brother Charles, he listens to us. We got Brother David D'Artes. He listens.
Good old bro 40.
Yep. And we got Dr. Chris. He listens. He definitely kind of gives us feedback. We've had Farah, our medical assistant. She's a faithful listener, gives us feedback and listens in. Jarrell, my brother, have to absolutely give him his due diligence because he's definitely a listener and definitely gives feedback and also sends screenshots of foolishness to say what we have said has somehow found his way into his timeline. Yeah. So we're there. Steve from our BNI chapter. Steve is a huge listener. Jacob from the chapter is a huge listener. So all of you, I'm trying to think who else are we missing. I'm sure we're missing it. Lady Dr. Jasper, as I was told, is definitely a listener. She's usually working and she'll listen to us whenever she's on the ride to deliver a baby or coming back home from delivering the baby. So definitely got to say thank you to her as well. I'm sure we're missing people, but at the end of the day, we're really saying thank you to all of you who are listening, who are sharing, who are giving us feedback, who are definitely doing the favor of telling us, hey, keep doing what y'all are doing. So we do this out of a labor of love, but we want to say thank you, thank you, thank you. And if we forgot you, it is no malice in our heart. We just sometimes are old and forget things. So with that, we're going to say, I think we're at a wrap. So George, where can the people find you in between seasons and also obviously when they see you out in the streets?
So I'm going to add 2 more names. I'm going to add George Sr., and I'm going to add Ashley, a.k.a. my little snook waffle. But also, they can find me at George_Becnel on X, Elon Mustang. You also can find me at Becnel Media on Instagram. And, I'm on LinkedIn too. So it's George P. Becnel, the second on LinkedIn. I also added the MBA on there. So
there you go. There you go.
Looking forward to that. Yeah. Let's get it. But yeah, so that's where you can find me.
Gotcha. All right. So for us, closing out season 2, you can find us on our website, www.byja.org, byja.org. You can find our nonprofit, Byja Charitable Alliance, at www.byjaca.org. And it is a nonprofit. So feel free to give us any donations you can. That'll help us to improve health equity, healthcare outcomes, administrative efficiency, and everything else. And it really and truthfully goes directly to patient care and patients in need. So if you are able to do that, please do. Every little bit helps. Every little bit counts. You can find us on LinkedIn, Facebook, and Instagram. And then, of course, you can support us by considering purchasing the Byja Blueprint book, which talks more about direct primary care for patients, physicians, and businesses. And it gives that introductory explanation on why direct primary care works, how it works, and why you should consider using the direct primary care model. So that is it. We will close out, and we will see you all in season 3.